Well, if you at home are feeling burned out, you certainly are not alone. This pandemic is sparking mental health issues as the virus continues to wreak havoc on our daily lives. So we asked Dr. Andrea Raby to join us here on Good Morning Arizona. She's the Vice President of Psychiatry at Bayless Integrated Healthcare to talk about what we can do. Doctor, thank you so much for joining us this morning. You know, we're heading into a holiday season. We are 9 months into our lives being completely altered, and we're looking at a holiday season where we likely won't be able to celebrate the traditions and, celebrate the nostalgia that comes along with the holidays. So let me ask you, as we head into the holidays, what, especially in your field, are you expecting to see?
Yeah, and thank you for having me, actually, Gina. I really appreciate the opportunity to speak about this today because, as you said, we are heading into the holidays, and it's even more important to really get the message out there in regards to mental health, our family's mental health, and also, COVID, and obviously continuing to abide by some of the CDC guidelines. So I think it's important to note that, first of all, there's a phenomenon called COVID burnout or COVID fatigue. And this is real, and it's important that we address and identify what those symptoms or behaviors are in order to manage that. In order to address our mental health with everything else. And if I can just take a moment to speak to that briefly in regards to those symptoms. We feel sometimes with COVID burnout, I think some of us can really relate to this. We can feel emotional detachment. As that emotional detachment increases, sometimes this can spill over, if you will, into our sleep architecture. We can have insomnia, and this can lead into problems with concentration. And it's okay to have a bad day once in a while, of course, especially during this pandemic. But the thing to take notice here is, are these bad days really turning into consecutive bad days? And when all these things are taken together and we take a step back and we realize this potentially could be burnout, that is when we have to manage it, especially during the holiday seasons. That is when we have to take the time for self-care and to ensure that we do things for ourselves and reach out to other people and make sure we still have those social connections.
And Dr. Raby, given some of these signs that you have talked about, how do you determine when you just need a little bit of a break versus you are in crisis mode?
Yeah, perfect question. Thank you. We all need a break. We all can determine that if we're feeling, tired or lethargic, or we have problems, like I said before, concentrating. Then that in and of itself means we have to take a step back from our computer when we're working at home. We have to take a walk outside and make sure that we can feel a little bit more refreshed when we're returning to our work-related activities. But very instrumental in that difference is, how are we functioning overall? If our overall baseline of behavior is significantly impacted and we're experiencing depression and other people are even noticing, then that is a big warning sign that we definitely need to reach out and get help.
How, at this point, besides some of those things that you talked about, taking a walk, taking a break, how can we prevent it to begin with, or if we're in it, how can we get ourselves out of the funk?
Yes, very good. And I think prevention is key. Another good point. Prevention is essentially remembering, being vigilant of all the coping skills that perhaps we used prior to COVID that really helped us. Sometimes with this COVID fatigue or burnout, we will rely on perhaps poor choices or poor coping skills, but being proactive with that and really engaging in coping skills that have helped us in the past is very important overall. If we feel that we're in crisis, if we feel that there's a huge change in that baseline of behavior that I mentioned before, then we need to contact your local healthcare provider. Also, you can reach out, for example, to Bayless. We do have 15-minute well checks for free just to get a handle on things and make sure that moving forward, we're well.
Yeah, that's fantastic. Dr. Andrea Raby, thank you for spending some time with us. And we always want to say, when it comes to mental health, if you need help, there is no shame in reaching out, and people should indeed reach out. So thanks for this important conversation this morning here on Good Morning Arizona.
Absolutely. Thank you so much. Appreciate it.